One of the most common questions I get asked all the time, what are the side effects of Ozempic? Are they real? Are they common? And most people aren't prepared for those side effects. But here's the good news. Most of them are manageable, and today I'm going to show you exactly how. Hi, I'm Dr. Peter Aziz. I specialize in urology and pelvic health. I work with patients every day who are taking GLP-1 medications like Ozempic. And I've seen firsthand what works and what doesn't work when it comes to managing these side effects. Today, I'm giving you practical, evidence-based strategies that help you feel better while your body adjusts to this medication. Before we jump into the solutions, we need to understand why Ozempic or GLP-1 medications, they cause these side effects in the first place. So GLP-1 medications like Mounjaro, Wegovy, Ozempic, they work by mimicking a hormone in your body called GLP-1. This hormone, it does a lot of things. It slows down how quickly food leaves your stomach. It signals to your brain that you're full, and it helps regulate blood sugar. So what is the problem? When you slow down your digestive system, you get side effects. So it's not a flaw in the medication, it's actually part of how it works. The key is learning how to work with your body during this transition. Keep in mind that most side effects are worst in the first few weeks, and they usually improve as your body adjusts to the medication. So let's talk about how to get through this period as comfortably as possible. One of the most common side effects is nausea. People experience this almost immediately when they start the medication. It can range from mild to really severe nausea that they're unable to keep food down. One of the things that can really help with this is eat smaller meals more frequently. Since Ozempic slows down your digestion, large meals will sit in your stomach longer and make your nausea worse. So instead of 3 big meals, try eating 5 to 6 smaller meals throughout the day. Second thing that you can do is avoid high fat or greasy food. Why? Because fat takes longer to digest. It stays in your stomach even longer when you're on this medication. So try to stick to lean proteins, to vegetables, whole grains, especially in the first few weeks after your injection. Third tip that you can do, and most people don't like this, try to stay away from strong smells and flavors, because when you're nauseous, even your favorite food can trigger discomfort. Things like rice, toast, bananas, and crackers, those are going to be your friends during this time. Also, ginger actually works really well for nausea, whether that's ginger tea, ginger ale, ginger capsules. Keep some on hand because they're gonna help you during the first few days. Usually the nausea will get better over time. However, if it's persistent or severe past the first few weeks, talk to your doctor. There are some prescription anti-nausea medications that can help, and in some cases, make the adjustment easier for you. Second side effect that we see is constipation, extremely common with Ozempic. And it makes sense when you think about it, because if your digestive system is slowing down, things don't move as fast as you think. So here's the action plan. Stay hydrated. This is absolutely critical. You need to be drinking significantly more water than you probably think. Aim for at least 8 glasses. If you can do more, that would be great. In addition to hydration, try to increase your fiber intake and do that gradually. The reason why you do fiber and fluid at the same time, because the fiber absorbs the fluid and it actually expands and stimulates your bowel to move better. There are some foods that have high fiber like legumes, like grains, fruits and veggies. Usually this is not enough and you need to supplement with fiber, something like Metamucil. Also try to be moving throughout the day. Even if you do a simple 15-minute walk after your meal, it can help relieve your constipation and it helps your bowel to move quicker. If none of this is helping, then consider a stool softener. These are different from laxatives. They work by drawing water into your stool to make it easier to pass. Something like DocuSate over the counter, generally safe to use. You can take it 1 to 2 times a day. However, just don't make it a habit. Don't get used to it. Only use it when needed. One of the other side effects that we usually see is acid reflux and heartburn. And because Ozempic slows your stomach, the stomach acid can build up and cause reflux or goes back into your esophagus. So what can you do about it? Very importantly, don't lie down immediately after eating. Try to wait at least 2 to 3 hours before going to bed. This gives your stomach time to empty a little bit and reduces the chances of the acid coming back up. Also, elevate the head of your bed about 4 to 6 inches. This uses gravity to help keep the stomach acid where it belongs. Also, there are some trigger foods that make heartburn worse. Things like caffeine, chocolate, alcohol, citrus, tomatoes, spicy food. You might not need to eliminate all of them, but pay attention to what makes your symptoms worse. Also, try to eat your largest meals earlier in the day since your digestion is already slowed. Because eating a big dinner means that the food is going to sit in your stomach longer and it's going to make your heartburn worse. If none of this is working, then you might consider over-the-counter antacids or acid reducers. Something like Pepcid or omeprazole, they can provide relief. However, if you're using them regularly, make sure you discuss it with your doctor. One of the most important things that we see with Ozempic is dehydration. Why? Because Ozempic reduces your appetite so much that you forget to drink water sometimes. Combined with if you're vomiting or you're not eating enough as well, dehydration can become a real risk. So here's how to stay ahead of it. Set reminders on your phone to drink water throughout the day. I know it sounds simple, but when you don't feel thirsty, you need something to remind you. Keep water visible and accessible. Keep a large bottle on your desk, in your car, next to your bed, in the living room. The easier it is to access, the more likely you are to drink. Also, track your intake. Use an app or just marks on your water bottle. Aim for that 8 glasses minimum and more if you are vomiting. Watch for signs of dehydration like dark urine, dizziness, dry mouth, fatigue, or decreased urination. And if you notice any of this, make sure you increase your fluid intake immediately. Just remember to time your dosing strategically for the injection, because when you take the medication can make a difference on how you experience the side effects. Most people inject Ozempic once a week, and they have the flexibility on when you can do this. So think about your schedule ahead of time and choose a day and time that works best for managing potential side effects. For example, if nausea is your main issue, you might inject in the evening so you can sleep throughout when the nausea is worst. If you tend to feel tired or dizzy after your injection, maybe a Friday evening works better so you can have the weekend to rest. The key is consistency. Once you pick a day and time, stick with it. Your body will adjust better if you have a predictable schedule. Also, never skip doses or try to adjust your dosage on your own. If the side effects are unbearable, the answer is to talk to your prescribing doctor about adjusting your prescription. Do not try to modify it yourself. One thing I always try to explain to my patient that your relationship with food changes when you're Ozempic, and you need to be smart about your nutrients and about your macros to avoid deficiencies. So try to make protein your priority. Since you're eating less overall, make sure you eat nutrient-dense food. Protein should be the star of every meal and snack. Aim for lean sources like chicken, fish, eggs, Greek yogurt as well is pretty good. Don't skip meals just because you're not hungry. Your body still needs fuel, energy, nutrients, even if it's a small portion. Try to eat something balanced at regular intervals. Can be something really small, but you still need the calories in. The other reason you need protein, because when you are losing weight, you want to maintain your muscle mass. So if you're not getting enough protein, you actually might lose muscle in addition to losing fat, which you don't want. Just remember, Ozempic is a very powerful tool. It's a really good drug for helping diabetes, for weight loss, but it's not without challenges. So if you made the decision to take the medication, keep in mind that you're going to develop side effects. They are real and they can slow down your progress. The strategies that I shared with you today, they can help you throughout the journey and help you cope with the side effects that you can get with the injection. Just be patient with yourself, stay in communication with your healthcare team, and don't hesitate to ask for help whenever you need it. If you found this video helpful, please subscribe to my channel and give it a thumbs up. Drop any questions in the comments below if there are any topics you want me to address. Thanks for watching. I'll see you in the next video. I'm Dr. Peter Aziz.